Hi everybody, welcome to the latest community conversation here at Atlantic Health System. My name is Luke Margolis, I'm the Corporate Communications Director for Atlantic Health. And joining me today on this community conversation, and we have two guests today, which is a little more than what we normally do, but we have an important subject that we want to talk about that we'll get to in a second. But I'll start at the end of the table, and we have Lydia Nadeau. She is the Executive Director of Atlantic Health System Cancer Care. Lydia, nice to see you. And between Lydia and myself is Dr. Rebecca Yang. She is with Atlantic Breast Associates. She is a breast surgeon with Atlantic Medical Group. Dr. Yang, thanks for joining us.
Thank you for having me.
So as I mentioned, very important topic today. In fact, we even have a new backdrop. So our more eagle-eyed observers will notice that that's different as well. And we are here today to talk about the AskHer campaign. And if you are an Atlantic Health System aficionado, as I know all of you are, and you've been watching some of the materials we've put out over the years, you may be familiar with this campaign. But if you're not, we're going to introduce it to you today. But before we do that, and before my guests and I engage in this discussion, just want to give you a little background on this conversation. You have a role to play here as well. You can add a question or comment to the thread alongside your video player, and we will try to get to as many of those as we can. Just a programming note, if for whatever reason you have to drop out of this conversation or the feed gets a little shaky for whatever reason, this entire session will be available on our website at atlantichealth.org, on various social media channels, including LinkedIn. The entire thing will be listenable, if that's a word, in an audio-only format on our SoundCloud channel, and it airs on weekends on News 12 Plus, Saturdays and Sundays at 8:30. Whew, there's a lot of information there. All right, so without further ado, why don't we jump into it? Lydia, I know that this is something that you have worked on for quite some time. The AskHer campaign, it might be familiar to some of our viewers, but for those for whom it's not, what is the AskHer campaign?
So it is a great campaign that started. This is going to be our 5th year of the AskHer campaign. And the way it was born and grew up in Atlantic is really something I'm so proud of for the team members that we worked through on this. About 5 years ago, we had a small group of managers who worked on a problem through our leadership development team. Sorry. Thank you. Thanks. And so they were tasked with the challenge of how do we increase our screening rates for women. They were kind of shocked that our screening rates were so low in our community, and how could we create an idea or a campaign that would spur people to action. And so with that campaign came the idea of AskHer, that the women in our lives, our moms, our friends, our colleagues are really important to us. And we ask them a lot of questions. Are you coming to the meeting today? Did you make my dinner? Did you pack my lunch? Mom, have you done all these things for us? Or, honey, have you made dinner reservations for the weekend? What are we doing? But we really never bring into the conversation the idea of, have you had your mammogram this year? You're really important to me. I love you so much. And this is something that I want us to talk about and help you with. And so that was the impetus for the campaign. What then happened is we pulled together a group, and I'm sorry, I'm just having trouble with my mask. It's a little loose.
Unfortunately, the occupational hazards we all have in the television space.
Thank you.
Sure.
Thanks. Sorry, everyone. And so with that, we brought together the marketing team, the actual leadership that thought about this idea, our central scheduling department, our operations team in the breast centers, and of course nothing happens without our IS components with us at the table. And we began to think about how we could make the campaign a reality. How could we take a call to action for our families? And so the AskHer campaign started as being able to go online and request an appointment 5 years ago. So we actually created schedules across all of our campuses, and women could say, oh, there's an appointment I see that's open on Monday at 8 at the Chilton campus. Let me book that in and request that appointment. And then the breast centers would come back and get that request online and communicate with our patients online. And so a woman could actually request an appointment at the end of her work day, or on a Saturday, or on a Sunday, and not have to think, oh my gosh, another day went by and I didn't get this done, and now the offices are closed. So we wanted to really make a 24/7 access for women. We wanted to make it simple for them to come online, and then we really started to, once we got the logistics out, began to really push on a marketing campaign around AskHer. And so that was really the impetus. It's one of the things I'm most proud of to be part of here at Atlantic in my years here, because it really has changed. And today, as we go into our 5th year, almost 5,000 women have booked their mammogram appointments through the AskHer campaign. So an incredible impact on prevention and screening on something we're so passionate about.
That's incredible. 5,000 folks who perhaps might have delayed their care or perhaps constantly been waiting for that more convenient moment to do it, who have been assisted in this way. And for folks who, to provide some broader context around the importance of this, Dr. Yang, I'm wondering, let's talk a little bit about mammograms and how important they are for women as we talk about this effort in getting folks to try to bring some consistency to making those appointments.
Thank you for asking. First of all, mammograms are the key to screening for breast cancer. They're the only breast imaging study that we have that is useful in helping women identify breast cancer early. And that has been shown to reduce breast cancer mortality by 30%. Mammograms have been around for more than 50 years now, and it's one of the very straightforward, inexpensive ways for a woman once a year to have a screening mammogram to get ahead of, to be active in her breast health. So the fact that you're saying that 5,000 women that may not have had a mammogram are having a mammogram, that's a huge number, and that means that hopefully they don't have breast cancer, but if you detect it early, the outcomes are so much better.
And I want to stay on that point for a moment because I think it's really important to reiterate. There may be some folks, and I've read studies in the past that say, well, I don't want to know my results. Or I don't get screening because I just don't want to know. But it sounds like what you're saying is, screening is the key, right? I mean, whether once you have that information, that can be powerful in helping your care.
Absolutely, because at this point in time, the care of breast cancer is ever evolving and improving, but at this point we don't have a cure for breast cancer. So if you catch it early, i.e. on a mammogram, that means you've caught it at an early stage, which in our world our goal is to cure you. 5-year survival rates, if you catch breast cancer early, are more than 95%. So that is why we recommend screening mammograms. It's until we have a cure, which still maybe in the future, but this enables us to get all the information and provide a woman a path to cure.
We're going to dive into various elements of this conversation as we continue on our way in this community conversation, but I want to let's jump right to something that's truly actionable. Lydia, what should, if somebody has heard this and has to run and can't stay for our whole conversation, how do they take advantage of this? What's the most important thing they can do right now?
They can go online and actually book their mammogram appointment at atlantichealth.org/AskHer. And you will see everything there to be able to book your screening mammogram. If you require more than a screening mammogram, say an ultrasound or other things, or you have any obstacles in getting your screening mammogram, there's a form available for you on that website. Just text us or write in and tell us what you need. We have a whole team here ready to address any issues you have. But you can go online today and book your screening mammogram. We'd love for you to have a physician prescription, but one is not necessary at the time of your booking. We'd like a physician to be able to be involved in your care, to share your results with him, but again, a prescription's not required in order for you to book your appointment. So do that today.
And on our website, maybe some of you are saying, well, maybe I don't have a physician. Well, on our website at the top, you'll see something there that says find a doctor, and you can click on that, and there's a whole wealth of expertise there for you to learn more about. There's profile videos for some of our physicians, so you can check that out if you're in need of a physician as well. There are a couple of angles that I think or questions I should say, that folks may have and may need some clarification around. The first one I want to touch on, and if you're both willing to address this in some way, that's great, but this idea of risk. You may have some folks out there, perhaps younger women, who have said, well, I don't have a history of breast cancer in my family, so I'm not worried about that. Do we really know all there is around who is at risk and who is not yet? Can a person sort of shut off that part of concern for them, or is it incumbent upon women to always be mindful of the risk of breast cancer? And Dr. Yang, if you want to start.
Excellent question, and a lot of women do come to me for risk assessment and they say, well, I don't have a family history, but there are a lot of risk factors. There's a risk factor for breast cancer is multifactorial, and the number one risk for breast cancer is being a woman, and then after that, it's age, because the risks are related to your exposure to estrogen. So the longer you live, the more estrogen you're exposed to in your lifetime. So there are multiple things that include family history is one, but other things like your age, when you started having children, did you breastfeed, do you drink alcohol, do you exercise, do you smoke? So it's many things that women can control and they can't control. So we actually have a way to help women when they come to our imaging centers to kind of get a sense of what their risk is for breast cancer, because it's multifactorial and there are different things that they might not think are increase their risk, which could be appropriate. So there's something called the Cancer Risk Assessment, which is a program that any woman coming to our institution who's having a screening mammogram can participate in. We give her a tablet, and she fills out information.
Like an iPad, like a digital tablet.
Exactly, an iPad. Very easy, user-friendly. We're all pretty familiar with technology nowadays. And she fills out a form. She answers questions, very basic questions about her age, when did she start getting her period, if she's still getting her period, if she stopped, how many children she had, family history, other things like has she ever had breast surgery before, and she puts that information into the tablet and then it calculates her lifetime risk for breast cancer. And that can help her have a conversation with her physician about risk management and what she can be doing besides getting screening mammograms to be proactive about her breast health.
Lydia, does it ever surprise you when you hear people say, like, oh, I can't be at risk, or I mustn't be at risk because nobody in my family has ever had breast cancer? Does that always sort of surprise you when you hear that from folks?
Yes, and there's an opportunity there really to go through education and really just sharing all the things that Dr. Yang just said with women and having them understand that, number one, being a woman is your first risk. And so we know so much, we've come so far with breast cancer and our treatments and our cures and our survivorship in the last 20 years. But the first step is getting a mammogram. Do not delay it. It's detrimental to your success.
That word you use, delay, there is one that I've talked about with a couple of our guests in various formats here at Atlantic Health System, because we know that one of the effects of this pandemic that we're living in right now is that a lot of folks, for a variety of reasons, right? Maybe there's a concern on their part about safety. Maybe there is the demands of life right now, with everybody having their schedules upended and changed, that a lot of folks have just not availed themselves of care. How big of a risk is that? Really just to your health in general, but specifically around breast cancer, for whoever wants to take a crack at it first.
So delaying a diagnosis of breast cancer can affect the stage at which you present, and then it affects the ability for us to work to, cure you. It affects treatment. If you delay a diagnosis of breast cancer, it may have gone beyond, it could have spread further. So it is a real concern in the health community. Looking at the statistics, the American Cancer Society predicts that because of the COVID-19 pandemic, there's going to be a delay in diagnosis of more than 30,000 breast cancer, colon cancer, and prostate cancer.
30,000.
They anticipate that. Wow. And we have seen it in our own institution when, rightly so, we had to change the way we practiced for safety first, because the COVID-19 pandemic was raging initially. And so women stopped getting screening mammograms. And I've even seen it in my own practice that finally women are feeling safe and coming back, but I'm seeing women who started their workup in March and because of the delays had to finish now. So that has been a real impact on the breast cancer community in terms of diagnosis and treatment.
It really, for us, it makes this year's campaign that much more important. It really, what we're seeing in terms of the media, in terms of delayed diagnosis, avoidable deaths over the next decade related to the delay in diagnosis and/or treatment, that we're hearing from our physicians anecdotally that they are seeing patients come in with more advanced disease. Again, anecdotally, but I think we're going to learn so much more in the coming years on the impact. But our early warning signs are there that there's a problem. And so that is why we're so passionate every year, but this year especially, on getting everyone out. And we're so thrilled to partner with Atlantic Medical Group and their work they're doing to send out cards to get patients in for their preventative and wellness visits. It's so very important, not only for cancer, but for all of our chronic illnesses.
So for the folks out there who are watching, if you've gotten one of those cards, take a look at it and take action on it, and do not delay that care. I want to get to a question about breast density, because I know that's something that, that some women may be curious about as well. But before we do, we have a question from Tina on Facebook, who is asking if, and this is a very natural question considering everything going on right now, are screenings safe, right? Is it safe to come get a screening? So if we can, maybe we'll handle this in two parts. If we can talk about what we've been doing to make it safe for people to come in, could be one thing. But then maybe even for women who just may not have ever had a mammogram. What is it like? What is the process? What happens during a screening? So why don't we start first with, what have we been doing to make it safe for women to come in to get screened?
So we've been following all of the protocols that have been established by infection control departments here at our institutions, both cleaning of any surface that a patient comes in contact with, whether it be the waiting room or the registration area or the palm scanner, anything, pens, anything. Those are actively cleaned before, during, after every patient, all throughout the day, and then cleaning certainly when the departments are closed in the evening. Patients are socially distanced. We're trying to do as much online with our patients to shorten the time of their visits in the breast center. And we're constantly asking our patients, do you feel safe? How was it today? And for patients that are feeling safe, they're out on Facebook telling other women to come on in. It's safe to get here. I think those were our really most important messages we really focused on early on and continue to push forward with our communities about it is safe to come in and get your mammogram. And if you feel at all uncomfortable, give us a call. We'll talk you through it, okay?
So what should a woman expect when she comes in for her mammogram? How does this work? What's the process, and what can patients look forward to?
So she'll check in at the front desk with our breast centers, right? And then she'll be escorted back. One change in practice is we're not really using our locker rooms, so we're having women change right in the mammogram room. It's one less contact point for our patients. And so they're changing and getting into their robes and getting their exam right in that one room. And then they really just leave within about 15, 20 minutes. It's really that simple.
It's that simple. Dr. Yang, what is the significance of breast density when it comes to mammograms and to breast cancer?
So breast density basically describes what's the composition of a woman's breast tissue, and the breast is made of a fatty tissue and the active breast tissue, and every woman has her own everyone's breast density is unique. But this all came about because about 50% of women have what we call dense breast tissue, which means that more than 50% of her breast tissue is active breast tissue, which can make it harder to look for very subtle changes on a screening mammogram. I tell patients it's like looking for a plane on a cloudy day or a polar bear in a snowstorm. And breast density has been also linked to it's one of the risk factors for developing breast cancer. The reason being, if you have more breast tissue, there are more cells that potentially could turn into breast cancer, plus the fact that the mammogram, the ability to find a subtle change is compromised. And so New Jersey has passed a law, like most states in the United States now, that a woman has to be informed of her breast density and that she should have the opportunity to have a conversation with her physician about what is she doing to address this in terms of the screening mammogram opportunities, and are there other methods to help screen to enable her to detect the breast cancer early. And so one of the things that we do at Atlantic Health, we offer women what we call three-dimensional mammograms now, or tomosynthesis is probably another word that a lot of people hear. What this enables our imagers to do is get a three-dimensional picture of a woman's breast tissue. And it's literally 1 millimeter slices through the entire breast. It's like getting a CAT scan of your breast. So the radiologists have a much more accurate picture of what the breast tissue looks like. This has been shown to increase detection as well as reduce callbacks. Another thing that we offer for women with greater breast density is screening breast ultrasounds too, which adds another way to look at the breast tissue, and that has also been shown to improve screening for breast cancer.
The conversations that I've had here never cease to amaze me as to how quickly advances in medical technology and in techniques happen. And when those changes happen, the dramatic effect they can have on our ability to provide care. I'm wondering, excuse the remedial nature of this question, but how far have we come with the technology around mammograms and breast cancer surgery, all of those things? How will the stories that women went through 10 years, 15 years ago, 20 years ago be relevant in any way to what's happening now? Or how far have we come in this science?
Well, I think the big theme has been, well, twofold. One is less is more, and the other thing is personalized, individualized patient management. Because we know more about the biology of cancer such that nowadays we always usually start off with just a needle biopsy to help a woman in her workup. And from that needle biopsy, most of the times we know everything about that cancer that can help us guide her management plan. Okay. When I first started training, everyone had to go to surgery first to have a lumpectomy or something before we could figure out what her breast cancer was. And then we had to work backwards and do other workup, and oftentimes she needed a second surgery. Nowadays, we can make a plan based on a biopsy. Sometimes, and also back when I was training, almost everyone had to have a mastectomy. But nowadays, most women can have a lumpectomy, an outpatient surgery, or the advances in our plastic surgery technology and techniques are so good that most women, if we have to perform a mastectomy, can have immediate breast reconstruction, meaning that the breast surgeon performs the cancer part of the operation, then we work with plastic surgeons who are specialized in breast reconstruction, and we work together. And so a woman wakes up as if she may not even know that she feels whole and symmetric, and it doesn't even look like she had surgery. Wow. So it's a big change from even 20 years. That's incredible. And eventually I might not have a job.
Well, it's funny, sometimes in medicine, it's like the goal is so that we don't have to do the work, right? So, Lydia, how about yourself? From your perspective, from where you sit, how have things changed over the years? And even in the last 5 years of this program, I'm sure things must be different from where we started.
So the adoption of 3D tomosynthesis has absolutely decreased the callback rates. Back to Dr. Yang's earlier comment. That was game changing. I remember presenting this project and going to 3D technology, and it didn't change our reimbursement at all. And I presented it to a large group. No one in the audience, everybody wanted to do it. Everybody wanted to adopt 3D. It became our standard early at Atlantic. Breast cancer is our #1 diagnosis across the health system. We treat over 1,200 women annually diagnosed positively with breast cancer. It's important to us, and we have always led in terms of the latest technologies, thanks to the leadership at the senior level here in our organization. So 3D really, really decreased our callback rate, which actually allowed us to have more capacity to see more women. And it shortened our time for waiting to get your screening mammogram each year, so our delays were less. So that was really game changing. The high-risk program is another one we're most proud of. So adding that to our comprehensive breast health assessment when you come for your annual mammogram has been game changing. And so, we're really now focusing on women who have a 20% or greater lifetime risk of developing breast cancer, making sure they understand what that result means, making sure her doctor knows what those results are. And that's kind of been the next evolution for us.
That personalization of care that Dr. Yang talked about.
Absolutely, and understanding what a woman could do, whether it's meet with our genetic counselor, meet with our dietitians, get on an exercise program, really work with a medical oncologist if they wanted to go on some preventative medication. So there's lots of preventive strategies that really weren't there for us years ago. So those are some of the things that I've seen in terms of the management of patients.
Shout out to Susan on Facebook, who tells us she went for a screening and it was extremely safe. See, so thank you for sharing that, Susan. Much appreciated. We only have just a few moments left, so there's two things I wanted to touch on. One, For patients who have COVID, the question is, how long do you wait to be screened? Is there guidance we can provide around that, or is this best addressed between a patient and their primary care physician regarding? Certainly, we would want someone to be past their infection before coming in, but is there any guidance we have around that yet?
So what we use in the hospital setting is around 28 days post-symptoms. That's really kind of the look that we're looking at right now. But again, it depends on were they hospitalized during that. There are a lot of factors. So back to your point, Luke, it's best to have the conversation with your treating physician because the severity of illness, did you require hospitalization? There may be a longer tail, but that's about the tail we're looking at.
Good to know. So for those on social media who are wondering, talk to your physician. You can get the answer there. Okay, another one. So we've talked, obviously, the name of the campaign is AskHer, right? It is about the effects on women. But there is, right, a portion of the population, of the male population, who can be affected by this as well, right? I don't want to end our session today without addressing this, at least in a small part. Breast cancer can happen to men too, can it not?
It can. It's very rare. Only 1% of all breast cancers do occur in men, but it's very important that men are aware that they can get it. And it's very treatable and curable as well. We don't do screening mammograms for men, but it's important for them to be aware about their health, and we can't ignore it. In fact, if anyone remembers the Richard Roundtree, he was the actor in Shaft.
In Shaft, that's right.
He had breast cancer.
Is that right?
Yes.
All right, so there, see, if it can happen to Shaft, it can happen to any guy out there. So good advice there. Okay, we are literally down to our last 2 minutes. So before we go, I want to just to share a final reminder for folks about how important this is. If you want to learn more about AskHer, you can go to atlantichealth.org/AskHer. But Lydia, we also have some phone information we can share with people. Do you want to do that?
Text. So the phone number is 844-343-3540.
And I'm going to jump in one sec. We will be posting some of this information on the web as well, so we'll have her read the number one more time, but if you missed it, just go to the website, and a lot of that phone information there is available too. Do you want to read it one more time?
Sure. 844-343-3540. And you could text AskHer to 555-888, and you will get to our landing page and schedule your appointment.
Perfect. Thank you. Perfect. So text AskHer, all one word, to 555-888. So that's an easy way to do it as well. All right, so this is our chance for those who may have joined us a little late just to share one final recap about how important this is. Dr. Yang, if I could start with you. Safe to say that when it comes to preventing breast cancer, a mammogram is the single most important thing you can do? Is that a fair way to phrase it?
I would say yes. I mean, the goal is to catch breast cancer early, and an annual screening mammogram is the key.
Excellent. And Lydia, AskHer, 5 years in. Does it kind of blow your mind to think that 5 years?
I think there's so many, when we talk to the original team, they're so proud of this, so it's really terrific. I think one thing we didn't touch on today, and I just want to make sure our audience knows, is for whatever reason there is a financial barrier to you getting your mammogram, get online, call us. We're here to help you, and we will help navigate you to a mammogram. So please don't let any financial barriers get in the way of your health.
Well said, well said. If you need any general information on AskHer or Atlantic Health System at all, go to atlantichealth.org. Our website has all the information that you could possibly need there on breast cancer or on any other health-related services you may need here at Atlantic Health System. Again, if you missed any portion of this community conversation, it is available on our website and on our social media channels. And this weekend, it will air on News 12 Plus. So check your cable listings for that. And it is at 8:30 in the morning on both Saturdays and Sundays. My guests for this community conversation have been Lydia Nadeau. She is the Executive Director of Atlantic Health System Cancer Care. And to my immediate left is Dr. Rebecca Yang. She is a breast surgeon, and she is with Atlantic Breast Associates. Thank you both so much for joining us today.
Thank you.
All right. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System. Thank you for joining us on this community conversation, and we will see you next time.